Good afternoon. I'm Elaine, coordinator for the Children's Oral Health Coalition. Welcome to our Growing Healthy Kids for Pregnancy and Beyond, What Nobody Tells You. That is our first topic for this year is healthy food and drink choices for now and later. Our series is called Growing Healthy Kids from Pregnancy and Beyond, What Nobody Tells You. These sessions are a unique opportunity for experienced parents to grow skills, awareness about a kid's oral health, overall health, and well-being. We want to help parents by providing access to providers, tools, community resources, and topics on difficult conversations as you navigate parenthood. The information we're sharing throughout the series is good for anyone that's there supporting parents, helping them with growing kids up healthy and safe. So today's conversation will focus on healthy food and drink choices for now and later. Starting habits early is an investment in your future and your child's future. What we eat and drink can affect our health, good or bad. We have a dynamic group of panelists who will share more information on how to choose foods and drink for a healthy mouth and body, picky eaters, and introducing new foods, eating on a budget at home or eating out, the importance of drinking water, and community resources that are available to help you from a food standpoint. I want to share just a brief information about the Children's Oral Health Coalition before we get started. We have 4 focus areas as a coalition. They're prevention, education, awareness, and advocacy. Under the prevention, we have a screening committee that provides school screenings in Tarrant County and some of the surrounding areas. We also have what we call the Waldabout Smiles Kit Assembly, where we assemble over 20,000 oral health kits every year, and we distribute those out to schools and different organizations working with kids from birth through 3rd grade. We also do, what we do under education is a train the trainer, providing education to community professionals. And that's usually nurses, childcare providers, anybody that works with parents and pregnant teens and women. We also do education to Ask the Doc through our Ask the Docs, and that's medical and dental providers that we're basically providing education about prenatal oral health. To make that better for that baby. And then we have what we call our virtual parent education, which is what we're doing today. What we do in awareness, we have oral health materials, kind of like what you see there. We do a dental brochure with no-cost dental clinics. And plus there's more stuff we do around education, like providing toolkits to providers, primarily educational providers. From an advocacy standpoint, we know change begins I'd like to say at home, but for me, it's really at the organizational system level. And we also look at access to care and coverage. And we have a program called Coordinated Care for Pregnant Teens and Women. And again, that's us basically advocating on behalf of the pregnant teen and mom. I want to thank our moderators again and panelists for giving your time and expertise so generously to us today. Our moderator today is Ms. Ashley Flowers. She's a registered dietitian and nutrition coordinator at Child Care Associates. Ashley has been a registered dietitian for 17 years, working in a variety of settings. In her time with CCA, Ashley obtained a grant to help expand CCA's gardening and ecological programs and to bring water harvesting and conservation to their campuses. Ashley manages Child Care Associates' nutrition team to create culturally and developmentally relevant menus. She also provides training to the cooks and housekeepers on new recipes or how to use unfamiliar ingredients. Ashley, thank you for joining us today.
Thank you, Elaine. I appreciate your invitation to be here. Can't really think of a better way to end March, National Nutrition Month, than with this great group of people to learn more about nutrition and healthy food and drink choices from pregnancy and beyond. So like Elaine said, I manage our nutrition program at Child Care Associates. We serve children and families, children ages 0 to 5. And we have a great opportunity to really start to introduce foods early because we often see children when they're first starting solid foods. And that's really important. We know that the more you introduce a food, the more likely it is that a child will grow to like it later in life. We know that introducing fruits and vegetables early helps children to develop a healthier relationship with them. But we also know that as parents and educators, even if things got off to a nutrition start that might not be ideal, we always have opportunities to model healthy eating for our children. So we hope to tonight provide you with information that's new to you, maybe dispel some nutrition myths that you've heard before. And I'm looking forward to learning a lot, and I hope you are too. We're going to get started with our panelists, and I want to invite you also, like Elaine said, if you have questions, to drop them in the chat box, and we'll have an opportunity at the end of our session to address those. So we're going to get started now, and I want to welcome our first panelist, Mercedes Cruz-Reese. She is the founder of Health Bridge for You and also a certified community health worker instructor. And Mercedes shared how many people she's instructed, and it was a lot. So she's excellent at what she does and serves our communities by bringing health awareness. And today is going to talk to us about using MyPlate.
I am so excited to be with you guys today. Thank you, Elaine, for the opportunity. Like Ashley said, I have been training for 16 years. I training a community at the grassroots level, but it actually began from a deep desire to change my life. I was 270 pounds, had recently gotten diagnosed with type 2 diabetes, heart disease, high blood pressure. I am a stroke survivor, so I really needed to hit the ground running and learn what is it that I needed to do. And thankfully to Agrilife Extension, which is with us tonight, I was able to make that connection in American Heart Association, and there began my passion for teaching. Next slide, please. So how many of us have ever just wondered, the doctor tells you, you got all these things, and he says, you need to lose weight. And you're like, where do I start? What should I eat? Why should I not eat? So how many calories? Okay, you're telling me an ounce, a cup, a tablespoon, and you're overwhelmed with all these questions. And do I write things down? And it really, really overwhelms. And for me, I really loved the fact that back then it was my pyramid because it gave me a point to start. Because sometimes doctors don't have the 2 hours, 3 hours to talk to you to kind of walk you through some simple process. So I was very excited that My Plate came up with a new approach. It's still the pyramid, but it's a little bit more upbeat and more fashion. So and they got some great tools and resources. So I love what I'm about to present to you. You probably already seen My Plate before, but how many times have we checked some other tools that the website has? And I put that on my first slide. If someone can get an opportunity to drop it in the chat box so that people can have it, because it does have some great tools that I'm going to share with you. And again, I hope you're as excited as I am to go down the what do we need? What do our head to toe really need? So next slide, please. Okay, so it is exactly what it says right here. Start simple. We don't need to go into this complicated diets and all these things that we need to do, and we need to drop this, and we need to just do all this change, because at the beginning where you're just starting, we just need basic information. Now, after you have mastered a little bit of this concept, you will need to get more information. But remember, we're bodies, we need nutrition. What nutrition? We mean nutrients, right? So Start Simple is at the core of helping people to understand exactly what they would need. Now, if you have an opportunity to see what is on your page, you'll see where it says healthy eating is important at every stage of life. I am 52 right now. I have no shame to say that. But, I started I got diagnosed in 2003. So at that time, there wasn't a lot that people would tell me. And you would say, well, at 52, is it a time to start your nutrition? No, nutrition should start at wherever you are at whatever time in your life. But it should really be started in our kids. We should start teaching them that proper health and nutritious food will stop them from getting some of those chronic diseases that I already have, that there wasn't much I could do at that time, but now I can actually manage well. I was 270. I have dropped quite a bit, but it was with small changes that I was doing and making every little bite count. So as you can see here, make half your plate fruits and vegetables. How many times have I remember just piling up all this food on my plate and wondering, I'm definitely overeating. Is this really what my body needs? Right. And then, of course, as you can see, limiting stuff like those added sugar. It seems to be that sugar is everywhere, right? Um, every package out there has sugar because it's a preservative. And then including that activity. Now, again, as a stroke survivor, there are certain things that I'm not able to do as far as activity, but we all can walk. So we can start very small, 10 minutes. Okay. And then vary your protein, and we're going to go through a little bit of that, and then make half your grains whole. What does that mean? Instead of that white bread, how about a more nutritious, fiber-rich, vitamin, nutrient-rich kind of grain that your body will really thank you for, okay? And then on the dairy, we understand the power of calcium. So going dairy, fat-free or low-fat will really benefit you. Next slide, please. So one of the things that I'm excited to share with you today is this great little tool that My Plate has. And for those of you that are wondering, we're all different. Like I said, I'm 52, so that plays a role. I'm a woman. I'm 5'1". And yes, no shame there. I'm 183 pounds. And then my physical activity, I get my 30 minutes throughout the day by doing special things here around the house and utilizing my Apple Watch. So I was happy to enter. If when I went into the start button, it asked me to enter all this stuff. And then it tailored what my body at 52, at 5'1", right, needed to lose weight, but better, more to stay healthy. A little bit of everything, for me to eat. So if we go to the next slide, I'll show you what the results that gave me. So it gave me this cool thing that said, your My Plate plan, it's 1,600 calories. Okay. And this is what we recommend for you. And I had an opportunity to download this great guide that tells me, talk with your doctor, about your eating patterns and your physical activity. Because again, this is just a tool. We always need to talk to our doctor. But it literally tell me, okay, Mercedes, you need to eat 1.5 cups of fruits. You need to eat 2 cups of vegetable, 5 ounces, and then we'll see in a little minute what that all translates to. 5 ounces of grains, 5 ounces of protein, and 3 cups of dairy. But it actually gave me another tool. It gave me a writing tool so that I can keep up with it and kind of know, did I hit my goals for the day or did I not? So that was very important to me because I needed something simple. I have a very busy lifestyle. I actually work 2 jobs and a half. So I needed something that I could do that wasn't going to be too complicated. So I found this tool to be very refreshing and very rewarding. Next slide, please. So this is where the thing breaks down. So it said, Mercedes, you need to eat 1.5 cups, right? But I was like, okay, 1.5 cups. Do I measure in a cup? Or is it, because I really don't have time to measure stuff, right? But by them saying, okay, you can have, in this particular case, 1 cup of raw, frozen, and cooked canned fruit. That was the beauty of it. It didn't tell me that everything had to be fresh from the grocery. When we walk into the store, that area that has all that fresh fruit, it said, this is designed for every budget. So for me, if I'm able to buy fresh, I buy fresh. But if I'm able to buy frozen, I can buy frozen. And if what I have is also canned, I love that flexibility with this particular plan. So, and then it tells me, okay, 1 cup of this, right? Or half a cup of that, or 1 cup of juice equals, 1 serving. So, but it also gave me the opportunity to read a little bit more. Okay. So I got the basics, but then a little bit more after that. Okay. Then the same thing it did for the 2 cups. What I was really shocked is that based on the traditional, so let me tell you, a traditional 2,000 calorie, you get 2 cups of fruit. But because my dietary needs are different, it only gave me 1.5 cups. Now, on the vegetables, you would think that it would give you all the vegetables, but the standard is 2.5 cups. But based on my personal needs, I only needed 2 cups to again balance, because that's what we're trying to do, get a balance of all the nutrients that your body are going to need. And then instead of the traditional 6 ounces of grain, it only gave me 5. And I was like, oh my Lord. 1 slice of bread is an ounce, right? How many of us have had that 6 tortillas? If a tortilla is 1 ounce, we eat 6. Whoa, we already blew all the grains that we can have for the day. And then on the proteins, it didn't give me that much of a change. It's 5.5 standard for a 2,000 calorie. And for me, it gave me 5 ounces. But one of the things that I love about this is that it tells you that peanut butter and beans and lentils do count as protein. So we don't have to do animal protein all the time, because remember, there is some saturated fat in that. And that's what we want to make sure we incorporate some of the other stuff that are equal to protein. And then on the dairy, we all know those. It's going to be your yogurts and your cheese. I don't eat cheese because I don't like it. So, but I do like yogurt. So I do a little bit more on the yogurt. But I found this very helpful, because now I have a clear idea of what my body at my age, my weight, my height really needs. Next, please. Oh, and another thing I love about this is the recipes that you're able to do. How cool is this? We have a recipe that's only 3 cans of beans, literally 3 cans of beans, and it requires almost no cooking. As you can see here, 1 can of beans, and it could be any beans. It could be black beans. I love black beans. I'm Cuban. It could be red beans, could be anything. 1 can of corn, and the corn could be frozen or canned, okay? 1 can of crushed tomatoes, undrained, because we're going to use that little water to get that chili consistency, and then chili powder to taste. So I really find this tool to be very effective. I go back, and the fact that it tells you how many people you can serve with this recipe, and the cost, if you can see, it just represents has $1 bill sign, because it's going to tell you it's very cost effective. The cans, depending on where you go, can be anywhere between 50 cents and $1. So I'm thinking with less than $5, you can make this recipe for your family, 6 of them, and still be nutritious, because there's a lot of vitamins and minerals inside all of these ingredients. So I hope that the information I share with you would inspire you to take on my plate. Thank you.
Thank you so much, Mercedes, especially for sharing that way that we can get things personalized for us on my plate. Because like you said, the pyramid was pretty one size fits all. And as we know, nutrition is definitely not that. So thank you very much. And for sharing your personal story as well, because that's always very motivating. So I do have a question from myself as a parent. What are your thoughts on breakfast? And is it true that breakfast is the most important meal of the day?
Okay, so this is my personal take and years of putting it to the test. Okay, so you are sleeping, and I hope you're sleeping at least 8 hours, right? Because your body needs that to repair cells. but you spend 8 hours. Do you remember the last time you ate? Because I eat at 8 o'clock. So by 8 o'clock the next morning, I would have had almost 12 hours without eating, right? I need to break that fast. My brain needs to get all that nutrient and energy from that breakfast in order for me to function, to start thinking. Imagine our kids, if they're not getting a nutritious breakfast and they're skipping breakfast, or you're skipping breakfast, are you being as productive as you need to be? If you're hungry, imagine the kids. If they're hungry, can they learn if their tummy is grumbling? So I am a plus for breaking the fast. That's what breakfast is, breaking the fast.
I love that. The break in the first word of breakfast, you can remember it that way. That's great. And we know, like you said, that keeping our blood sugar stable can help our children with academic performance, with energy, and even with concentration. So that's a great insight into breakfast. And before we move on, I wanted to share just a little bit about if you have a child that's a picky eater or a choosy eater. I certainly have 3 of those, so I can relate and empathize if there are other parents on here that have that experience as well, because my plate is great and it gives us all of these details about the nutrients that we need every day. But if your child really limits himself or herself on what they will eat, that makes it really hard. And as a dietitian parent, that is really hard for me, knowing the things that I know and having my kids just not really be interested in some things. So here's some things that have helped me, and I hope they'll help you too. So respecting my child's appetite, knowing that they're in charge of their body and they know when they're hungry and if they're not. And we know that we need to move away from the clean my plate, clean your plate club, and more towards letting our children recognize their own internal cues. And we know that that can decrease the risk of obesity and overeating later in life. And it also really gives our children that sense of autonomy, which a lot of times children really want to exert with eating, because that's something that they can control. Another thing that can help with picky eaters is sticking to the routine. So your child knows exactly when breakfast, lunch, snack, dinner are every single day. And then recruiting your child to help you. So we know that when children garden or when children help cook, when children set the table, they're more likely to try foods. And then just very briefly, keeping in mind not to beat yourself up if your children don't eat fruits and vegetables, for example. There's a hierarchy of food. The first thing is to tolerate. So if your child can stand being at the table when you serve a food that they won't eat, then they interact with the food. So maybe that could look like your child blowing a green bean across the plate. They're not going to eat the green bean yet, but they're going to interact with it a little bit. Maybe they start to smell the food. They can be in the kitchen when you're cooking that food and smelling it. Next step would be touching the food. That could even be something non-mealtime, like maybe doing potato stamping or something. They're touching it. They're getting used to how that feels to their skin. Next step would be tasting it. So some of the preschoolers that we work with that maybe have some sensory issues, we talk about licking a food and making it get all wet, like it would be if a puppy dog licked you. And kids like to pretend in that way. And then finally, the last step in the hierarchy would be to eat the food. But just keeping in mind, if you're at any stage of those with your picky eater, then you're getting there. So just hang in there. And with that, I want to move on to Robin. Robin Hall is a dietitian, and she works for, I'm going to read it because it's a long title, Expanded Food and Nutrition Education Program for the Texas Agrilife Extension. So Robin really likes to work with individuals in making small changes that make a big difference in their health. So I want to welcome Robin to talk about healthy eating on a budget at home or out.
Thank you, Ashley, and good evening, everyone. As Ashley said, my name is Robin Hall. I am an extension agent for the FNEP program, which is a nutrition education program that's facilitated through Texas A&M Agrilife Extension Service. Our program provides nutrition education to limited resource families and youth throughout Tarrant County. But if you haven't heard of Agrilife Extension before, we are an organization that provides or just education in several different areas, not just health. We offer programming in horticulture, agricultural and natural resources. We are the hub for the 4-H program in Tarrant County, which is a youth enrichment program. And then we have other programs that provide health and wellness education to the public as well. I've been with Extension for about 6.5 years, actually 5.5, closer to 6 years. And I'm really excited to talk to y'all today about eating healthy on a budget. This is one of my favorite topics to talk about. I don't have a lot of time to talk about it, but I'm going to try to cram as much information in as I can. So let's go ahead and get started. Next slide. So a little bit more about the FNEP program. We are a community-based nutrition education program. We provide research-based education. So My Plate, like Mercedes was just talking about a minute ago, is definitely one of the foundations of what we teach to our participants. And we assist limited resource families and youth in acquiring knowledge, skills, attitudes, and change behaviors in the 4 following areas that you can see on your screen. So we talk about basic nutrition. We cover My Plate. Talk about food safety, how to keep food safe for your family so you aren't suffering from food poisoning or other foodborne illness. We talk about food resource management, such as, like I'm going to be talking about today, saving money whenever you're going to the store. And we really encourage our participants to get physical activity. By participating in our program, participants learn to eat more fruits and vegetables. They learn to save money at the store. They tend to start preparing more meals at home. Excuse me. And they usually get a lot out of our program. So that leads me into what I'll be talking about today. You can go to the next slide for me. I've tried to condense healthy eating, excuse me, y'all, sorry, into 5 tips. The first one is, if you'll go ahead and hit that, is define your healthier. Healthy is a great word, but y'all, it is a loaded word. What's healthy to me might be completely different than what's healthy to you. Mercedes touched on this a little bit when she was talking in her presentation. The main thing that you want to be concerned with when it comes to eating healthy is just getting started. Maybe your doctor has told you that your cholesterol is high. And so for you, it might be important to start with cutting back on some of the foods that are higher in fat and maybe increasing some foods that are higher in fiber. You also have athletes, on the other hand, whose diet is going to be a little different than someone who is trying to cut back on their foods. They need to make sure that they get plenty of proteins to build and repair their muscles. Some people just need to eat more fruits and vegetables. And if that's you, that's great. That is a great place to start. So when it comes to being healthy, don't get bombarded with all the things that you hear on the news or that you see on social media or that your friend recommended to you, because it's really easy to kind of get bogged down with that and then you don't know where to start. My Plate is a great place to start, but you also want to start with your needs and your family's needs as well. So from here on out, I'm going to be referring to eating healthier on a budget as opposed to eating healthy on a budget. Let's go to the next tip. Next tip is to make a budget. It's really easy. Okay, so I said this is like one of my favorite topics to talk about. I'm a grocery shopper. Like, I like going to the grocery store. I like doing the online shopping and putting my groceries in the cart where I just have to go pick them up. I discovered that during COVID, but I also do like actually pushing a cart through the grocery store and going up and down the aisles. I don't know. I just like doing it. But when you enjoy doing that, it's really easy to run to the store, pick up this, pick up that, pick up this, pick up that. Oh, I have to run to the store and grab this. I need to run to the store and grab that. And before you know it, it's the end of the month and you have spent way more money on food than you thought. And this doesn't include eating out. So you want to make a budget. The beauty of a budget is you get to create it and you're in control of whether you stay within that budget or whether you bust the budget every month. Excuse me. So start with, maybe just 1 month, pay attention to how much you spend on groceries and kind of go from there. Lane, I see that the tips are going. We're still on tip 2. But think about how much you want to spend on your groceries based on maybe how often you go to the grocery store. So if you have $400 that you would like to spend on groceries every month, which as much as food prices have gone up recently, that's probably realistic for more of us than it was 6 months ago. So you have $400, you go to the grocery store once a week, you divide that $400 by 4 times. So you ideally should have $100 to spend every time you go to the store. Choose what works best for you and your family. If you have, it might be wise for you to separate on your budget how much you're going to spend on groceries and how much you're going to spend dining out. Because if you do both frequently, those lines get blurred, and then again, it's affecting how much you're spending at the end of the month. If you receive SNAP benefits, include that as part of your budget so you know about how much you need to come out of your pocket every month. If you know that summer is coming, what tends to happen during summer if you have kids who are home all day, every day? Probably spend a little bit more. The holidays usually tend to spend a little more, not only because kids are home, but also because things are at a premium. You're hosting friends or family over for dinners. So make your budget, and which will allow you to kind of plan how much you want to spend. As Mercedes said, know kind of like what foods are more expensive than others. Organic foods tend to be a little more expensive than inorganic foods. Buying produce in season will affect your budget because it tends to be a little cheaper when it's in season than when it's not in season. Strawberries are a prime example. Peak of summer, you can get strawberries for $1.99. Sometimes you can catch them on sale for 99 cents. But during the winter, they're $4 and $5 for a container of strawberries. You also want to consider maybe doing some canned fruits and vegetables. There is nothing wrong with canned fruits and vegetables. I feel bad for them sometimes because they get such a bad rap. But they can be included in a healthy diet just as much as fresh fruits and vegetables can. Let's go to the 3rd tip. So I kind of mentioned planning ahead. There's a lot of things that kind of go into this. One, you want to plan a grocery list, and start by perhaps planning your menu for the week, or even if you plan 2 or 3 meals that you're going to prepare that week, take a look at what you have on hand already in your refrigerator, in your freezer, in your pantry. Plan your meals based on what you already have. Then maybe use My Plate to fill in the gaps, and then make a list of the things that you need to be able to complete that meal or make it more of a balanced meal. Also, you kind of need to plan with your budget as well. Like I mentioned, if you know that the summer is coming up and kids are going to be home, you might want to think about the types of things that you're going to buy for them to snack on. We hear all the time people say that eating healthy is expensive. But I kind of want y'all to do a little experiment. Go to the store, even if you don't buy it, price it out. Go to the store, get one banana, get one bottle of water, get one individual size container of yogurt, and then maybe get like a can of almonds or mixed nuts that will serve as a snack for a few times. See how much that costs. Then price out a bag of chips, a soda, a candy bar, and a snack cake. See how much those cost you. See what the price difference is. And you will see that eating healthy doesn't always, it can be expensive if you get overwhelmed and you try to change everything all at one time. But generally speaking, it's not as expensive as some people think. So think about those types of things as you're planning. Also, plan to use your leftovers whenever you're cooking. Leftover chicken can make a lot of things for the next day. You can cut it up, put it on salad, you can put it on a sandwich, and then guess what? You save 10, 15 bucks not going out to eat for lunch. So consider those types of things. If you have if your grocery store of choice has a, let's say ground meat that's on sale 1 week, and if it's in your budget, go ahead and buy an extra package, cook it up when you have time, pop that ground beef or turkey or whatever in the freezer, and then it will be ready for you for your spaghetti or tacos or sloppy joes for you to pull out one night. You'll be way more apt to come on home and prepare that for dinner using that method than maybe going through the drive-through that's going to cost you in your family a little more. So that's tip 3, plan ahead. Let's move on to tip 4, which is use your resources. A lot of time people think of time as a resource, which it is, but kind of like I was just saying, use your time. Use your time to prep meals, or even if it's prep part of a meal. Time is a good resource to use. Also, technology. Everywhere has an app. All the stores have apps now. There are apps for coupons. There's apps for rebates. My Plate, as you just saw, has tons of information on their website. So use technology as a resource. You do have to be careful when it comes to things like coupons and those loyalty programs with different restaurants, because the whole purpose of those things is for you to spend more money. So when it comes to coupons, definitely use the coupons for items that you typically buy rather than using the coupon just for the sake of using the coupon. But also know that there are different apps and things out there that you can use that will give you rebates or deep discounts on some of the items you purchase, whether it's a grocery item or even eating out at a restaurant. I use one, I'm not gonna advertise it right now, but the rebates that I receive from that app is actually part of what we use for Christmas every year to purchase gifts. And so it's kind of like the gift that keeps giving. You also want to use the staff at the store as your resource too. Now, some stores are going to be better than others, but the manager of the produce department will be able to communicate with you the different types of produce, when it's in season, how it's best to store it, the best ways to prepare it. Maybe if you're in a pinch and you don't quite know if something's on sale and that's how much you have left in your budget and you don't quite know how to prepare that, a produce manager would be able to help you with that. Because if you think about that, all of that affects how much money you spend. If you're buying 10 bananas where 5 of them get freckly and brown and you end up throwing them away every month, you're not really saving money doing that. You're more like throwing money away. Anytime food goes into the trash, it's basically putting dollar bills in the trash. So part of eating on a healthy budget is purchasing items that you are going to use and that will not go to waste. And then my last tip is don't go on an empty stomach. We've all heard this one, because what happens when you go to the store hungry, you start picking up all kinds of things, and then you've spent way more than you need to. But we don't hear the tip about eating out, not eating out on an empty stomach as well. So I don't mean go to the restaurant full, but maybe consider eating a piece of fruit, drinking a cup of water, maybe eating some veggies and dip, just so you have a little something on your stomach. And that may prevent you from ordering the appetizer, which is going to save you money and calories. And then as an added bonus, you got an extra fruit or vegetable in, which most of us don't get enough of anyway. But yeah, those are my 5. Those are very general tips on eating healthy on a budget. Hopefully they kind of inspire you to try to do some things to improve your dietary habits when it comes to purchasing food. You move on to the next slide. We are on social media. These are all of our social media. I don't know what the term is, but feel free to visit us on social media. And then the next slide just has my contact information. I've also included our FNEP website and our Agrilife website. Feel free to visit either one or contact me if you have any questions or would be interested in hosting FNEP classes with your groups. Thank y'all.
Thank you, Robin. Appreciate that overview of healthy eating on a budget, and also that experiment to try at the grocery store. I'm excited about doing that. You've had a lot of experience educating a lot of families. I'm curious, what do you think the biggest challenge that we face is with healthy eating on a budget, if you had to pick one?
I think the biggest challenge would be just sifting through all the health information that we see and kind of knowing what to do with that information. I think sometimes it inspires people to make healthier choices, but it also confuses a lot of people. And the first thing, and then I think we kind of automatically revert back to eating healthy is expensive anyway. So, we kind of brush that off and continue on with whatever habits we're currently practicing when it comes to diet. So I think all the health information is just can be really challenging to people.
Yeah, that makes a lot of sense. We're kind of inundated with it everywhere. So starting small and choosing what's healthier for you, because we're all at different stages.
Exactly.
So thank you. That was a great overview. So next we have Dr. Trin. She is a pediatric dentist with Texas Colgate Bright Smiles, Bright Futures. So in addition to being a dentist, she's a community coordinator, and she's going to talk to us about water, which this is a super important topic as we move on in from spring to summer. So looking forward to learning how to make it fun for us and our children. So thank you, Dr. Trin.
Thanks, Ashley, for the introduction. Like Ashley mentioned, my name is Dr. Trin. I've been a dentist since 2010, and I've been with Colgate Bright Smiles, Bright Futures for close to 3 years now. It's been great. The program, we focus on doing free dental screenings and oral health education for children ages 12 and younger. Obviously, we stopped doing the screenings temporarily due to the pandemic, but we've shifted towards more virtual education for children and parents at schools and community organizations. But we hope to get back in the field soon. But I'm excited to be here to talk about the importance of water. Just like Ashley mentioned, summer is just right around the corner, right? So what's more important to talk about than about water? Yeah. So let's go ahead and get started. So I'm excited to talk about the importance of water too, because as a dentist, when I was in private practice before, this is kind of the topic that we kind of have to struggle with parents and patients too, because, obviously water's great for our teeth. We always stress like drink more water, not too much soda or any kind of sugary drinks, because that can lead to cavities. But we all know that water is also important for our overall health too. So let's talk about why drinking water is important for your child and why water is a great choice for your kid. So water is super healthy. There's no calories, no added sugar. It's also great for their body. It keeps their joints nice and healthy. Like I mentioned, it's good for our teeth. It doesn't cause cavities, and it helps for the blood to circulate. And it's also good for your child's mind. It keeps them nice and hydrated so they can concentrate and focus on school or whatever things they need to do. So let's talk about how much water your child needs. So it's recommended to introduce water to your child at the age of 6 months and to give them about 4 to 8 ounces of water a day until they are a year old. And the rest of their liquids can be supplemented with breast milk or formula at this time. And when they reach the age of 1 to 3 years, you should give them approximately 4 cups a day, either water or milk. By age 4 to 8, increase that to about 5 cups a day. And then older than that should be around 7 to 8 cups a day. Right, so we talked about the importance of water. So let's touch on the signs of dehydration in infants and children. So you see any of these signs, you should immediately take your child to the doctor to have them evaluated. But some signs of mild to moderate dehydration include if you notice your child has dry mouth, if they're not urinating as normal. In infants, this means producing less than 6 wet diapers a day. If you're noticing that they're playing less than normal, when they're crying, they're not producing as much tears as normal. And if you have an infant or toddler, if you notice any kind of sunken or soft spots in their head, this is a sign of dehydration. And if the dehydration is caused by diarrhea, the child's going to have loose stools. But if the dehydration is caused by vomiting or lack of fluids, this is shown through less bowel movement in the child. All right, so let's touch base on some severe dehydration symptoms. So with these symptoms, is in addition to the symptoms that I previously mentioned, they include, if you notice your child being very sleepy, lethargic, if they're very fussy, if you notice their eyes are very sunken in, this is a sign. If you notice that their skin is very wrinkled, and if you touch their hands and feet, they should feel very cool to the touch, and they should also be discolored. And lastly, if you're noticing if they're just urinating 1 to 2 times a day. So this is a very serious sign. So like I mentioned, if you notice any of these signs in your child, take your child to the doctor immediately to have them evaluated. All right, so let's talk about how to make drinking water fun. So I know, it doesn't really taste good, so we have to kind of do some things to make it more fun for your child. So you can add frozen fruit in place of ice cubes. You can add fruits like berries, cucumbers, lemons, limes, just to give it more taste to the water. You can have your child pick their own special drinking cup. I think this makes it more exciting for them, make it more fun, because if they have their own special drinking cup, they're always going to be excited to use it to drink water. And also another tip would be to have a reward system set up for your child each time they drink more water. For example, if they drink their water, you can give them a sticker each time. If they drink their water and they give you an empty bottle, y'all can do like a special dance together. So the important thing is just to associate more fun things, more positive things with drinking water to make it more fun for them. And some other tips would be to just be a role model. So if you're drinking water, they're most likely to follow these healthy habits if you do the same thing as them, okay? And also another tip would be to carry a water bottle everywhere. So you have water in the car, in their backpack, on trips, etc. So then you're not automatically having to like, oh, we're thirsty. Let's reach for, soda. We automatically think of something tasty. But if we have a water bottle with us, we know that that's what we need to drink when we're thirsty. So it's more convenient to have it with you everywhere. And obviously try to choose water over sugar sweetened drinks. Like Robin mentioned before with the budgeting, water's not going to cost as much as those sodas, right? So this falls right in line with what Robin spoke of before about the budgeting. And then when we're eating out, so eating out is always fun to do with your child, right? To go with the family and eat out, it's fun. And if you associate it with, ordering water instead of soda, this is going to make it more fun for them to drink water. And it also, ties along with what Robin said earlier with making a budget for healthy eating. So when we're ordering water, when we're eating out, that costs no money, right? So, yep. Hopefully y'all thought those tips were helpful.
Yes, thank you. And for the tips on what to look for with dehydration, especially those more serious signs. We know children's bodies don't have as much water naturally, so it's really important to look for that. I want to ask a question kind of on behalf of children everywhere who don't like to brush their teeth or floss. If my child only drinks water, are they going to get any cavities? Are they going to avoid getting cavities because they're avoiding sugary drinks?
So it's a combination of everything. So we just have water and nothing else, then we're not going to get cavities, right? But we're going to, drink water, and then we're going to be eating the food, right, that we have throughout the day. And all the food, even the foods that are not straightforwardly sweet, there's always added sugar in it. So there's always a chance of cavities just as a part of our diet, because there's always added sugar that you don't know unless you read the label that there's sugar in it. And that's what causes cavities, that sugar. So, if we just persist on just water only, then no cavities. But, since we, eat food and other things, then there's always a chance of cavities. So that's why we always stress brushing and flossing. We can't get rid of that, so yes. So we can't just not brush and floss. That's always the tools we need to use to prevent cavities. Thanks, Ashley. Yeah.
Thank you. I appreciate the overview and the importance of water. And we're going to move on to our last panelist, who's Kathy Robinson. She's also a registered dietitian and the manager of healthcare partnerships at Tarrant Area Food Bank. So Kathy works with healthcare providers in the community on screening and addressing food insecurity and connecting people to actual resources in real time that can help them address their issues. So Kathy's going to talk to us about some of those resources. So thank you, Kathy.
Great, thank you so much, Ashley. The panelists have shared some great information about healthy eating and how important it is for children and adults. But especially right now, a lot of folks are struggling to get those healthy foods, to eat according to My Plate or the dietary guidelines for Americans. And that's where Tarrant Area Food Bank comes in to help families get access to those healthy foods. We know that low-income working families, families with children, older adults, people with disabilities, single parent head of household families are more likely to maybe have limited access to healthy foods, and they have a tendency to do some trade-offs. Well, I have to pay rent this month, so I can't go out and buy the healthy food that is so important for my body. Or my doctor wants me to take this particular medication, so if I pay for that, I'm not going to be able to afford food. It's important that we think about not having enough food as a medical issue. We know that when children and adults have limited access to healthy food, they just can't afford it, they're more likely to develop chronic diseases like diabetes and high blood pressure and heart disease. And we know that, especially in children, that limited access cannot, it sets them up for a lifetime of impact on their health and their well-being. So there are a couple of questions, and think about these statements. And if you say that these particular statements apply to you often or sometimes, then Tarrant Area Food Bank is there to help you out. So the first statement is, within the last 12 months, we worried whether our food would run out before we got money to buy more. If you find that to be often or sometimes true for you, please reach out to Tarrant Area Food Bank. The second statement is, within the past 12 months, the food we bought just didn't last, and we didn't have money to buy more. Again, if you find that to be often or sometimes true for you, please feel free to reach out to Tarrant Area Food Bank. We partner with over 400 organizations in the 13 counties that we serve. And, not only providing food at the different pantries, but we provide assistance on completing SNAP or WIC or TANF or even Medicaid applications. We do cooking classes and gardening classes, because if you can grow your own food, that helps out with the budget. And it's also that fresh fruits and vegetables piece that everybody's been talking about. We also sponsor a neighborhood farmers market with a WIC program to connect WIC families to fresh produce. And at the farmers markets that we partner with, you can use your SNAP. There's a double up food bucks where you can spend your SNAP dollars and get twice as much with fresh fruits and vegetables with that. We have a lot of resources on our website, and we're fortunate that Elaine and her team are going to be sending out the links. We have cooking demonstrations, we have gardening information, we have access to a lot of different resources. So I know it's 7:02, so Ashley.
Thank you, Kathy. I appreciate it. Thank you for sharing about the resources. And like you said, Elaine will be sharing the links and of course your contact information if anyone needs to reach out or knows anyone who would like to reach out. And the food bank is so great and unique in that it really breaks the myth of a food bank giving only like beans and rice, and there's always produce, there's dairy, there's meat. So you really do work to make sure that you're providing the healthy foods that everyone else here has recommended. So thank you for sharing your resources with us. Thank you to everyone. This has been a great time. We ran a little bit over. I think maybe we have like 2-3 minutes for some questions.
Is it true that you should not give infants water?
So according to the Academy of Pediatrics, you should start introducing your child to water at 6 months of age.
Dr. Trent, is there such a thing as giving a child too much water?
I think there is. That's why there's that designated amount of how much they should get in a day. Yep. And I think it's the same for us too. We can't have too much of a good thing, right? Yeah.
True.
I had a question for Kathy. Kathy, you mentioned it's Tarrant Area Food Bank. What are all the counties that you cover?
Well, Tarrant County, Denton, Cook, Johnson, Hill, Bosque, Hamilton, Somerville, Hood, Parker, Wise, Palo Pinto, and Erath. So, yeah. We cover the western half of North Texas if you think about the map that way.
Very good. I have a question. Mercedes, what are some alternatives to My Plate that can still help families choose, make better choices?
Well, I found that the simplest one is that one. Okay. The
Okay.
easiest to follow because, it customized, but definitely they're going to be, the NIH, the CDC, all of those websites have a lot of information. And of course, your provider has a lot of resources. It's just that people, when they go, they don't ask about a lot of things. They just go
Mhm.
in, they get that done and they walk away. But if you ask, your doctor can actually recommend some resources. And again, there's a lot of agencies out there that like Agrilife. I refer a lot to Agrilife because they have a special program that even graduates people, right?
Mm.
Robin. So that's why I said the food bank. I work a lot with the food bank also because they also have information for people. So it's about reaching out. There's a great resource called findhelp.org. And and I know it used to be Ann Bertha before, now it's findhelp.org. We also have Tarrant County Care, but looking into and realizing what is it that's out there for you. If that My Plate doesn't work, there's a lot of alternatives. But for me, it's been the easiest to teach because I don't want to give too much to people at one time. Unless you're a registered dietitian and then you can do a complete meal plan for the person. That has not been my case.
I see another question that just came up in the chat. So Sabrina says, my 2-year-old daughter's hemoglobin is low. What food do you recommend her to eat to bring the level up?
That's a doctor question. Dr. Friend?
I think I'm a tooth doctor, so I don't think I can answer that question.
I think that's a great question to bring up with the pediatrician. But if you think about, what things can raise hemoglobin that are not going to do any harm to your daughter are things like that have a lot of iron. So red meat, broccoli, spinach, actually any kind of animal protein, chicken, and then making sure that those things are always paired with something that has vitamin C to help the iron be absorbed. But of course, remembering hemoglobin can be low because of other B vitamins, not just iron. So it is important to figure out what is going on. Does that help to answer your question?
And if I can just piggyback on that, calcium can tend to do the opposite of what vitamin C does when it comes to iron. So, of course, kids need their milk, but if they are drinking too much of it, that can actually cause hemoglobin to drop a little bit, especially at 2, because that's the finicky age. Anyway, and so sometimes it's hard to get them to eat, and instead we give them a glass of milk just to make sure they had something. So just kind of be mindful of how much milk she's drinking, or cheese or yogurt as well.
That's great. She has a nutritionist to help guide you along there, especially when it cooks, because they provide great resources. So I have a question for Dr. Trin. In terms of your teeth and your children's teeth, is it okay for them to snack on food, kind of graze throughout the day? So it's like their teeth are always kind of in contact with with food?
So we don't really recommend that. We recommend maybe 2 to 3 snacks a day, just because the constant snacking, that means that their teeth are constantly covered in food. There's always that, maybe there's like a lot of carbohydrates, sugar in that food. So that means just more instances of getting cavities. So we recommend maybe 2 to 3 snacks a day to kind of space things out so they're not, their teeth aren't constantly just covered in food and not clean. Yeah.
Yeah,
Thanks,
that
Ashley.
makes a lot of sense. And it sticks with staying with a routine, so that's good.
There's a question in the Dropbox.
Okay, sorry I missed that. What other vitamin can make a child have low iron? And does sugar cause tooth decay?
So Dr. Tran, will you take the one about sugar and tooth decay?
Of course, I am a tooth doctor. So yes, sugar does cause cavities. That's what the bacteria we have in our mouth, that's what they feed on. So when we're eating that sugar, they're eating that sugar too. And if we're not cleaning it off and it stays on our teeth, the bacteria kind of breaks down that sugar into an acid. And that's what causes cavities. That's what causes the tooth to weaken and get a cavity. So yep, sugar does cause cavities. So only in moderation, that's what we recommend. I know we can't avoid it. It's important for our bodies, for energy and everything, but in moderation, right?
And
The
then
key
there's
word. Yes.
the question about the iron. What vitamin can make a child have low iron?
So I can, maybe I can clarify a little bit. So when hemoglobin is low, it can mean that there's an iron deficiency, a folate deficiency, or a B12 deficiency. So I think what Robin was talking about was when a child has a lot of calcium with iron containing foods, the calcium makes the iron not be absorbed as well. And that's one of the primary ones in children, right, Robin? The calcium. In adults, things like the tannins in tea can inhibit iron absorption. Children could have tea as well. So thinking about things like that. And then with the low hemoglobin, it's really important to make sure that there's not other things going on. And we tend to jump to iron, and most of the time in kids it is iron, but also remembering that folate and B12 could be low as well, especially in families that eat vegetarian or have a vegan lifestyle.
I heard that tooth decay is poop while we sleep. Is that true?
That is interesting. I've never heard it put that way before. So when we sleep, we have a lower amount of saliva in our mouth. So the saliva is a protective factor for our teeth to help protect against cavities. So when we sleep, we do have a higher chance of getting tooth decay. Hopefully that kind of answers your question. But if that's why we recommend to brush your teeth before going to bed. So then we're not going to bed with all that we eat and drink from the day and going to bed with all that on, because then once we do that, then we go to sleep and we don't produce as much saliva in our mouth. All that factors in to cause cavities. So
I wanted to thank our panelists again. And maybe if there's just one word of wisdom you could leave us with, we could start with Kathy.
If you're having trouble accessing enough healthy food for children to grow or parents to be healthy, don't feel ashamed. Reach out to your medical provider or seek out other resources. I know that's more than one word, but there you go.
Thank you. And then I'm just kind of going in order of how I see you. Go to Mercedes.
for me is start. Just start. I mean, start and start simple. Don't get too overwhelmed. And again, like Kathy, can't do it in one word, but yeah, start and start simple. And then just keep on. Take another step, and soon you'll be a master at your own health.
That's great. Thank you, Mercedes. Those are great words. Robin?
Believe it or not, I was going to say like almost the exact same thing that Mercedes said, but start small. Because even like she was saying in her presentation, those small changes, they really add up at the end. So small changes can make big differences. So start small, just start somewhere.
Great. Yeah, just do one thing. That's all you gotta do to start. So that's great. And then we'll end up with Dr. Trin.
And I just want to piggyback off of that too. Starting small is also is a great way. And I know that, drinking water is kind of hard for all of us. Sometimes, we're all attracted to, those sugary drinks. That's what we think of. But if we start small, like saying, hey, I'm going to just drink, let's start drinking more water during lunch, or I'll have a glass of water at each meal. And then they'll just make it easier and easier that way.
Great, thank you. So I'm going to hand it back over to Elaine to wrap us up. I did see one more question. I don't know if we have just a minute for a toothpaste recommendation, or if that's something you want to reach out later.
Dr. Trent, I'm going to try to help out with this one. What we recommend is that you use an ADA, American Dental Association toothpaste, and one with fluoride.
Yep.
And if
And
you go,
I'd recommend that too, even though I work for Colgate. It doesn't matter about the brand. As long as it has fluoride in it, that's the most important thing.
this has been great information. It's been helpful and eye-opening to me. I have actually learned a lot, but it has been a really great conversation, and I hope everybody has been able to take something away. Ashley, you were a great, phenomenal moderator. We really appreciate it. So thank everybody for being here, and hopefully we'll see you at the next one on April 26th.